last Monday, I threw my back out. Like,
Yeah.
or what it felt like it threw my back out. And
Yeah.
I'll tell you the story is
Yeah.
when we
Do you want to get into it?
Yeah, we might as well.
Okay. Here, so Raj and I are going to do a mock evaluation. This is for educational purposes only. And so we'll just start from there. All right. I'll shut up. You talk.
All right. So here's the mechanism of injury. What happened was I was working with somebody. I was doing a suboccipital release. At the office I was at, there was no high-low table. So I was in a bent position. You know, I was down like this.
Yep.
I had my hands here. Then all of a sudden I felt and heard a very strong pop in my thoracic, my mid spine.
Okay.
I kind of knew that it was a bad pop. So I kind of just excused myself, and then I got the rush of pain and spasming started.
Yeah.
Of course, I knew better, and I just tried to did some gentle mid-range movements from there.
Right.
But it was bad. I was in a lot of pain. And then I waited out the rest of that night. All I could do was very gentle mid-range movements.
Okay.
Couldn't really tolerate a lot of extension at all.
Yep.
I was just pretty much, I was at neutral though.
Yep.
Slept it off. The next morning, of course, I had the morning stiffness and pain, like a lot of it, which I expected. So it didn't freak me out, but it was there. I was able to get in the car and go to my office.
Okay.
When I got to my office, I was in neutral, but I was absolutely unable to tolerate even 1 degree of extension.
Okay. Gotcha.
And rotation-wise, I'll demonstrate how much rotation I had. Maybe this much to the left, maybe I would say like 10 degrees.
Okay.
To the right, maybe 20.
Okay.
Before I started hitting a 5 out of 10 pain.
Gotcha.
Bilaterally. It was different degrees I could go, but both sides was a solid 5 out of 10.
Okay. Gotcha.
Just walking, it was a constant 2.
Gotcha.
2 to 3.
How long ago was this, by the way?
This was well, now it's been a week. Yeah.
Okay. 1 week.
It was just last Monday.
Gotcha.
Yeah, so a little over a week now, but it happened that last Monday, and then the Tuesday was when I noticed that I couldn't really move that well.
Okay.
So then I got through the rest of that morning, and then I asked the therapist to work on me a little bit, just to get me to rotate more. Mildly successful.
Right.
I was able to, at least tolerate walking and treating for the morning. It felt like a derangement.
Yep.
Because it was moving from the left rib around segment T9 to
Yep.
T10. And then sometimes after she worked on me, it seemed to have centralized back to the mid-back.
Okay.
Back to the center.
What was she doing on you that seemed to centralize that?
She did an MET on me, a very gentle MET just to increase my left rotation. Okay. But the results didn't last.
Gotcha.
By the time I went on my lunch break, I sat in my car. My feet was dangling off the side of my car,
Yep.
and I coughed. Yeah, and as soon as I coughed, I knew, and I was stuck sitting on the side of the car with my legs dangling out. And I was like, all right, well, I just got to get up and go to lunch.
Yeah.
I was literally unable to get out of that car.
Jeez.
I'm not exaggerating this because it was freaking me out.
Those thoracics, I mean, it's just like a huge broken rib. I mean, it's going to feel the same.
I was stuck in that flex position in the side of the car. I experimented with mid-range movements, just get some rotation. Mm-hmm. Unable. Absolutely not even a degree of rotation.
Gotcha. Hey, Raj, did you have stuff rotating or coming around the front to like sternum at all? Or
nope.
Just real low?
Purely right in the side of the rib and the mid back, and that's it.
But nothing radicular anywhere else, localized to that spot?
Nothing spread from there. Of course, it was a very strong spasm in that area, even when I tried to get out of the car. Yep. I was unable to flex forward. Before that, I forgot to mention, I was trying some flexion here.
Yep.
Which I just wanted to move, and that seemed to have helped. I did notice that earlier that morning, if I extended my neck, it would relieve a little bit with flexing of the neck.
Yep.
I would feel it.
You feel
there.
that pull?
So I felt there was some neural stuff going on as well.
Okay.
Or at least some kind of tension there.
Yep. But nothing down the arms.
Nothing down the arm.
Nothing that affected the neck to where you couldn't rotate your neck.
Left to middle. That's all it would go to.
Okay.
It kept bouncing out from there.
Okay.
But back to when I was in the car, I started to panic around minutes 3 and 4, and I was like, "Yeah, this is not good."
Yeah.
Then of course, I started every breath kind of felt like a sharp stabbing pain.
Okay.
I was like, "Oh, what did I do?" And then because I couldn't really exhale that much, and then so I knew it was thoracic related.
Yep.
Then I shit you not, I couldn't get up till minute 20.
Oh, geez, dude.
20 minutes out of that hour break, I was stuck in that car. Around minute 15 to 20, I had to, just get out of that panic state and just did some deep breathing, some, like mini meditation.
Yeah, absolutely.
I knew there was, if I was a layman, I would have called 911 for sure.
Yeah.
For sure. I was even, by the minute 20, I was ready to call my manager to cancel out the rest of my patients.
Right.
I couldn't get in the office, in the building.
Dude.
But I forced myself up, and I was able to go back in.
Okay.
However, at this point, though, I was stuck in flexion.
Okay.
Totally unable to extend at all. Just stuck like that. Had some of the girls work on me a little bit more. They all seemed to think I needed extension.
Yep.
But again, I was unable to tolerate any of that. They did that.
Were you able to lay flat, like get on a plinth and just lay flat on your stomach or back?
I did. I did do that. It felt okay, but definitely could not do prone on elbows at all.
No.
At that point, just flat. So I did that for a little bit.
Gotcha.
And then I was able to stand up straight again. Mm-hmm. My rotation again was still the same. The rotation never improved. It was 20.
Really stuck on left.
Right, 10 degrees to the left before hitting a very strong spasm.
Got it.
But I felt like I wanted to go to the left. I felt like I needed to do that.
Yep, absolutely.
Just from my knowledge, I just felt that was the direction I needed to go.
Okay.
But it was rough. The rest of that day went by, and then around the evening time when the day was done, I was able to lay flat. I told one of the other therapists, I just need a manip.
Yep. Absolutely.
She did a very great manip. She, although I don't know, she said, "Oh, your rib was like an inch off, like out of place." And you and I both know that. I don't know, things don't necessarily go out of place, but that's what she said it felt like.
Yeah. So probably had a lot of
very loud
spasm going.
Very loud cavitation. Afterwards, I felt euphoric.
Nice.
After she did that, I was now able to. I was able to rotate at least 50% to both sides.
Okay.
And I was able to extend now. Before I was not able to extend at all.
Great. Did that stick around for a while?
Then after that, well, I'll leave blank what I did.
Okay.
I'll let you figure. I'll let you go for it.
Fun part, huh?
Yeah.
All right.
And I've tried every single motion and remembered my response to it. So I'll just listen to you what you say, and I'll tell you what would have happened.
Okay, gotcha. So, how was that night? Like after she popped you and you felt better, how was that night?
That night was much more tolerable.
Okay.
I felt like immediately better after that.
Gotcha.
There was no question in my mind.
Good. How about next morning when you woke up stuck, like all over again, step one?
No, it was the morning stiffness and pain was there, but less than it was the previous morning.
Okay.
And I was able to get into there's another office that morning, and I did some repeated motions. Mm-hmm. By that afternoon, I was 100%.
Nice.
Which was incredible.
Okay.
Absolutely incredible success after just two days of being unable to stand up straight. I was now 110% by lunchtime by that day.
Nice.
But I won't tell you what I did yet.
Okay. So if this was me and that was an extension mobilization?
Mm-hmm.
Like an extension manipulation, she just had you on your stomach and then?
Just had me on my stomach and just did the thrust.
Just a PA? Okay.
Just a PA. Yep.
Nice, man. And no weird numbness or tingling?
None of that.
Any
Just,
sort of bowel or bladder issues?
None of that.
No signs or symptoms of like vomiting, anything goofy like that?
No. Just besides the sharp pain with the strong exhale, none of that. Pain that would take your breath away almost is how I would describe it.
Gotcha. Now, did breathing also become a lot easier the next day? Like no big deal?
Absolutely. I didn't even notice it. Yeah.
All right. Sweet.
Yeah.
All
the
right.
breathing was good the next day. Yeah.
Good. So if you maintained, let's say you maintained your extension, if I saw you, I'd probably have done the same thing, man. I would have done a manipulation. If nothing else would have loosened you up, I would have probably done little tiny mobs and then seen if I could have sent you home. Let's see if I can actually do this. Basically, hands around the neck like this.
Yeah, of course.
Extension.
So I'll tell you what I did.
Yep.
I did that.
Yep.
Absolutely, same exact method. Before she manipulated me, I was absolutely unable to do that.
No, man. No. You can't do that. It would have just been intolerable. If anything, I would have probably done the same thing. I would have probably just prepped you a little bit, had a pillow under your chest to kind of gap you and give you a
that would have been smart.
And then do tiny mobs and then seen if you could have done this. And if not, and you were still stuck, I'd have seen if that was something that was doable, if you could tolerate it.
Let's say you were unable to do the manip as we're doing with telehealth.
Yep.
So what would have been, since I was unable to tolerate the extension, what would have been the way to go?
I would have seen if you could have at least done some sort of bilateral rotation.
Precisely.
At least would have loosened you up a little bit and gotten that joint at least some sort of flushing, because there's going to be a massive inflammatory process going on there.
Yeah.
Thank God it wasn't that horrible, because even with that manipulation, if the inflammation was that bad, you wouldn't have been able to sleep that night, because it's not like inflammation goes from it's all inflamed to gone.
Yeah.
It's a cycle. Right. So that leads me to believe that it was mostly just the freaking rib was so deranged. It's just whack completely.
Which is what it felt like.
Yeah. I would have just done some sort of gentle movement that you could tolerate with the focus of trying to get as much rotation
so
as possible.
I did a whole lot of this, throughout. And, of course, left was more limited.
Right.
So what I ended up doing was I didn't even really bother go to the right. I probably should have just went both ways, but I just kept teasing the left.
Yeah.
Just kept teasing that left.
I mean, because with a rib specifically, what I usually look for, if anything starts wrapping around and coming up into the sternal area, and it's only on one side, then I really focus on that one side. Like, have you seen the whip, basically?
Yes. Which is what I wanted to do, but of course I couldn't.
There's no way, dude. You're stuck.
There was absolutely no way.
No. So I would have just gone with some easy mobility, and then
mid-range movements would be perfect for a patient over telehealth. That would have been my choice too, and that's what would have absolutely helped me. Absolutely, just focusing on that for at least the next day, because this is super cute. This is being done the morning after it occurred.
Yeah,
It happened that night, Monday night, and all this is going on Tuesday.
Right. So imagine this is the scenario that telehealth, at least it could have helped in some sense. Because think of it this way. If you're a farmer, you're an hour outside of town, you live basically, you're solo, you're by yourself, and then you get an issue like this. There's no way in hell you're driving an hour to get somewhere.
I wouldn't be able to.
Yeah, you're completely stuck. So any sort of movement just to mobilize the joint would be my number one.
Thank God I knew what I knew, that I had to move. But if I was just a layman patient, I would have needed somebody like you to tell me, hey, it's okay to move. Yeah. And just tease it. Go to that end range strain.
Yeah.
Say hello to it, come off. Say hello to it, come off.
Yep.
I would have needed somebody to tell me to do that.
Yeah.
Which helped tremendously, because I was doing that regularly throughout the day.
Right. And the big precautions that I would have totally gone after was anything that was a radicular symptom from that, made sure to clear out the lumbar spine. I might have even given them some sort of slouch correct to kind of work on a tiny bit of extension.
Which I was doing, but unfortunately, all I could do was go to neutral.
Yeah, just get into neutral.
Yeah, that's all I could. I'm sure that would have increased over the next couple of days if I just kept doing that. I'm sure I would have increased dramatically.
Yeah. But that's the prime example of if it's available, and if I would have seen you and wouldn't have been able to move you at all, but you had some sort of access to somebody that could, even put a towel across that level of your back and just kind of pin you down a little bit. Do you know what I mean? Not doing even a specific hands-on mobilization. But
what I just got the idea when you mentioned that?
What's that?
What if you could advise, let's say I've had a pillar in my house, and you could take a belt or something, wrap it around that, maybe perhaps wrap it around, if I'm facing the pillar, wrap it around that, and then use that as a self-PA. I think that would have been tolerable.
I would have found somehow to do it lying down, because that extra stress of loaded, especially because you're a younger guy.
Gravity. Yeah. So, okay.
Yeah. A loaded position wouldn't be quite as effective as an unloaded in that acute state.
In that acute state.
Yeah.
So what are you thinking, laying on an iron board or?
Something like that. But you can even just take a long bath towel and wrap it and then put it around you and keep that up high and just kind of push on it.
Okay. And then tease it like a prone press up almost. Got it.
Exactly. Yes. But real high up, right on the level of that thoracic, to kind of at least give yourself some mobilization. But it apparently needed so much force to kind of undo that I really would have taken more time.
I treated it very aggressively because I wanted to get back.
Oh, absolutely.
What I needed to do.
Yeah.
I'm sure if I didn't get the manip, it would have taken its natural course of healing over at least a week or two.
I think so.
Just like it would with a regular patient.
Yep.
Yep. So the manip wasn't necessary, but definitely helped me get back to 100% by day 3. But over telehealth, that farmer stuck in Minnesota. Yeah. That would be a great option. I'm sure I would have been able to tolerate that. Absolutely.
Yeah. Many ways to go over it there. I'm trying to think of what else. Of course, I would have cleared the C-spine too. Even though that's super, super low on the thoracic, I would have still cleared some sort of.
Except when I noticed the flexion extension, I knew there was some neural tension going on there. I didn't really exhaust any retractions or anything like that.
It's if and you can put your finger on that, you felt that pop, and you could like that sort of instantaneous. Oh Lord, what just happened there?
That's exactly what happened. Yep.
Usually, you would say if it was a cervical involvement with that sort of mechanism of injury, like you'd have been like, no, I could not move my neck at all. That's usually one of the first things I would hear if it was something that was like. But usually that shoulder blade area, that's the type of pop, and then they have that. It's a high thoracic.
So this was lower than that. Yeah,
much lower. So I'd have just asked a few questions to kind of clear that out to make sure
absolutely
that it wasn't something about that. Trying to think of something else in the history that I might have used.
I guess it's worth mentioning. This has happened before when I was a student. Similar mechanism of injury, except instead of working on someone's neck, I was working on somebody's. I was doing an MET on somebody's pelvis. Of course, bad body mechanics, same type of flex position. And at that time, one of my TAs was Mackenzie certified, and he told me to do the repeated thoracics rotations. But this was weeks after I hurt myself, and it helped. But I didn't get that advice until weeks after.
Right.
That was a lot of lost a lot of sleep from pain.
Yeah. So since it doesn't sound like it was something that was lateral, I would even say just during the day, man, since you're especially doing notes and stuff, we're all in this position, kind of that crouch position. Right. I would probably say just during the day on a regular basis, at least carry over with maybe 5 or 10 of these.
Mm-hmm.
Just absolutely. Kind of get that thoracic extension that might set you up for it. But again, it's one of those precursors. Like if you're going to lift something heavy, do a couple of press ups just before.
So how about if let's say I was still unable to tolerate extension, would you have gone lateral? Would you have started treating rotation?
I would always rule out central first. So I would exhaust that central plane with anything I could do. I mean, if it took stacking from no pillows to 1 pillow to 2 pillows over a 10 to 20 to 30 minute time frame, I still would have stayed there and seen if that could have made you tolerate some loaded thoracic extension in a seated position.
Interesting.
Just trying to find some way to give you enough force to reduce your symptoms, and with the concurrent sign of increased rotation each way.
Yes. That would be the asterisk sign. And then
Right.
Okay,
Yeah,
that makes perfect sense.
I would have exhausted that sagittal plane. But honestly, in the clinic, I'd have done exactly what you did. So gone for it. And then I've had the same stuff too. Just like, please, somebody plot me right now. Please. Like, what? Yes, do it right now.
Yeah, that's exactly what it was. Yep. I just knew I needed it, but that's just from my knowledge, though.
Yeah.
But then, so I think had I seen that patient on telehealth, that's what would have helped me. Those movements definitely would have been successful.
Right.
Then I'll give you. So I'll just tell you what happened then.
Yeah, go for it.
What happened on Wednesday was I had tried. That day I was feeling better. I was able to rotate. This time to the right, maybe 40 degrees, but to the left, maybe 30 degrees.
Okay.
So a lot better than the original, like 5 or 10 degrees, but still was reproducing the 5 out of 10 pain with left rotation that Wednesday morning.
Gotcha.
So reproduction there and a reproduction there, same spot on the left side.
Yeah.
And I did a set of, this is Wednesday morning, I did a set of repeated rotations to the left, just gentle, no velocity, no force, just saying hello and coming off.
Mm-hmm.
And then I was like, you know what? Let me try doing some side glides on the wall.
Okay.
So I did left side glides on the wall with overpressure there.
Gotcha.
I did 10 of those, except my hand placement was not on the usual hip like you would with the lumbar patient.
Yep.
I put my hands more on the ribs itself.
Okay.
Give myself some kind of immobilization there.
Yeah.
I did 10 of those, only 10. And then I felt immediately better.
Okay.
And I just I had this internal feeling like, hey, I could rotate now with no issue.
Right.
And then from there, I was now able to rotate. All of a sudden, go to end range without velocity. Reproduce the pain at the end, but it would go away.
Okay.
It would reproduce and go away.
But your motion stayed good even when you were checking. It wasn't like you did it and then 2 minutes later it was back to, I'm stuck.
No, that was right after I did that side glide against the wall.
Mm-hmm.
It never went worse. Ever.
Nice. Good.
And then I did some side-lying thoracic rotations with some breathing. Mm-hmm. I did that like 20 times. And then I was now, after doing that, I was now able to go for velocity.
Okay.
Then I was doing the high velocity whips only to the left. By lunchtime Wednesday, I was 110%. Didn't even notice.
Nice.
Anything wrong.
That's awesome. Great. So yeah, I would wear out completely.
Yeah, see, that's something I didn't do. I did not wear out the pain at all.
The easiest part though is this information and you have that internal, okay, what's happening with me?
Yeah.
There's a lot less digging that needs to happen when you're able to successfully treat yourself and find that one movement that kind of opens things up.
Which is where the patient education comes in play for the farmer in Minnesota.
Oh yeah.
You want to educate him, see if you can find the strain, the end range strain, touch it, come off, and then kind of educating them that movement's healthy. And that's where the pain sign stuff comes into play, of course.
Yeah, it's just like if you dislocate a shoulder, think about it that way. The next day, your shoulder's not going to be 100%. Exactly. I mean, you're always going to have some sort of because if something was irritated to the point where you could not move, obviously something in that tissue was a little wonky and haywire, be it just a neurological inhibition where your brain is telling you, hell no, don't go that way. Or if it was something where it was mechanical, where the joint itself was a little wonky. And basically, that's the one thing I would want to make sure is that they kept moving.
Yes.
Wasn't something that created some sort of chronic cycle.
Exactly.
So, of course, if they are, it completely depends. If they have a job that's a lot of bending and lifting and it's forward motion,
most jobs do. Yeah.
Yeah, I'd worry about that coming back. So I would give them some sort of precautionary type of thing to do at least multiple times a day to keep that from coming back for that first week or two. Because derangements, you've seen this before. Derangements can go away in a day, but they can kind of creep back up and be there for a month. Yeah. Unless you do something that's prophylactically keeping that inflammation in the.
Yeah, I will admit I stopped. I was good with doing it every couple hours.
Yeah.
And I haven't done any repeated motions for a good week now.
Do you feel 100%?
I would say I get like a 1/2 out of 10 reproduction when I did that. The same spot.
Yeah. So just a 1/2 out of 10.
Yeah, but I know it's there. I know it's there.
Yeah. So I would, since you've been able to do something that's in that lateral aspect or the rotation part, I would hammer away on some extension to get that final bit.
Okay.
That usually will knock the rest of that out. Mm-hmm. But if it reproduces and makes it worse, then go back to rotation.
I just noticed just now when I was demonstrating earlier that I felt something there, a similar spot.
Right.
But but for the farmer in Minnesota, see what happened was he or she might have some fear of movement. I didn't have that fear of movement. I knew that movement was going to be healthy, yet, what still gets me is that I was unable to get out of that car.
Yeah.
20 minutes, even though I had the knowledge that, hey, this is nothing wrong. I'm going to be okay.
Right.
I'm sure it would have been a lot worse if I had some fear. Mm-hmm. But even then, I just was unable to get up. It was the darnest thing.
Yeah, it's nuts, man. I've had those. I would say literally when they say 80% of people at some point in time in their life are going to have something like this, I think it's sometimes 100%. I mean, literally, I would say such a huge percentage of us actually get those type of symptoms or those scenarios, and we just forget about it because it goes away after a week.
It goes away after a week.
Sore throat. Can you remember the last time you had a sore throat? No. Not really.
We've all had it.
It was like 2 days ago, but everybody knows they've had a sore throat before.
Yes.
So like myself personally, I've done tricep extensions, and I gave myself basically a anterior derangement in my neck. So I was doing this, and then, oh boy, and I can't move anywhere except extension.
Oh, wow.
Like, oh, God. I couldn't go left, couldn't go right. Flexion was a no-go. And I was like, I must need to do some retraction extension. Well, here's what my extension looked like. And I was like, oh, no. So you just
so we have to start
the crap out of that. Yeah.
Yes.
And so that's the beautiful thing about using the mechanical diagnosis system is that you can teach a patient to slowly progress some sort of movements. And it's all about mobilization. Like McKenzie always said, he didn't freaking know if it was a disc or if it wasn't. He just wanted to see the symptoms reduce and resolve. And he wanted the patient to have their function come back.
Exactly. Yeah. So, it's about that asterisk sign, whether it be, in my case, I was the rotation. For the farmer's case, maybe it was lifting something in the barn,
Yeah. So that's good, man. I'm glad it went away. That's a huge plus.
Yeah. So am I.
But next time you get one, just shoot me a message on my phone and we'll do this. We'll do this
live for real. That would have been really, really cool.
Yeah.
But it just goes to show that, I could have taken care of this in a hands-free manner.
Yep.
With your guidance.
Yeah.
Absolutely.
It just was a lot faster with that manipulation.
It was just a lot faster with that, but I don't doubt that it still would have been gone within 7 days with just exhausting repeated motions.
Right. Yeah.
Absolutely.
And just the guidance and the knowledge that you weren't stuck like that forever.
Yeah. It's the comfort.
Yeah. Just given some sort of parallel.
To decrease the spasms and tension, the fear-related spasms.
Right.
Which a lot of our patients do get.
Yeah. Exactly, man. Exactly. Cool. Well, yeah, that's a good case, man. Definitely. I think people will learn a little bit from that for sure, because they're all going to have people that might be second or third day walking into the PT clinic.
If not later. Yeah.
Yeah. It's kind of rare that you'll see somebody be able to come in, day zero, like they just did it a few hours ago.
A lot of the times they're going to be a week or two out, and it's now just a very bad ache.
Yeah. Yeah. Good scenario, man. Good learning experience for sure.
Yeah, for myself. Yeah, absolutely.
Yeah.